Today we have Declan in clinic, and unfortunately he has suffered a patella tendon rupture. And we're going to go through his case today and have a look at how we're going to manage his rehab so that he can get back playing football. Not many people are unfortunate enough to pick up an injury this severe, but let's have a listen to his story.
So I was playing local footy at my new club and went up for a mark, and then as I've gone up for a mark, I've heard a big whoosh kind of sound, and then as I heard that, landed after I took the mark heavily on my elbow and my knee, and then looked down and my knee was dislocated, and then tried to put it back in, and then obviously I couldn't put it back in. So at footy, waiting for the ambulance to come, ambulance came, got me on the green whistle and the fentanyl to reduce my pain, and then they managed to get my knee back into place. And then I knew from after they got it back in that it still wasn't right because the pain was still excruciating, and then I went straight to my GP, got a referral for x-ray, MRI, all that stuff, got it done, and then I was in by surgery 2 days later, so yeah.
A patella tendon rupture is a huge injury that disrupts the knee's extensor mechanism, and that stops us from being able to extend the leg. It typically results from an acute mechanical overload. So this is when you may land in a flexed position of the knee. So imagine jumping up, and as you land, the knee is bending under all of that load. Now, as the quad's on top of the thigh, there's 4 muscles there. They extend the knee, but what they do is they go down into the quads tendon over the knee, via the patella tendon into the top of our shin bone. Now, when the quads contract, this allows us to lever the shin bone up, which is effectively what extension of the knee is. Now, when we rupture this patella tendon, we've effectively lost the ability to straighten that knee. And this is often when we need surgical intervention. Now, after surgery, we need to allow that knee to heal, and we need to set the environment for that. If we stress that knee too much, sending the heel towards the bum aggressively, the tissues aren't going to heal. So what we're going to do is we're going to lock that knee in extension, and that offloads the tendon to allow it to the best chance for that to heal. Over the course of 3 weeks, we actually do want to start to see that heel go towards the bum, but we're only going to allow it probably go to around 45 degrees, and we're going to lock it in there. And in that window between 90 degrees and 45, we need to start seeing Declan stressing that knee and mobilizing into that. And that helps prevent joint stiffness, and it helps us regain that range of motion that we've got available there. Now, these early mobilization protocols have really demonstrated excellent outcomes, with patients achieving near normal knee function and strength. However, rehab should be absolutely tailored to the individual, considering factors such as the extent of the injury, surgical technique, and patient-specific goals. We're week 7 now, post-op. There's different phases that tendon goes through in terms of healing, and we're definitely in the remodeling phase, and this is where we really need to kind of kick on with trying to get that range back and actually start to strengthen that quad. Now, in this final phase, the collagen matrix undergoes remodeling with a gradual transition from type 3 to the stronger type 1 collagen. This process enhances the tensile strength of the tendon, which is so important. Therapy focuses on progressively increasing loading through strengthening exercises to facilitate optimal collagen fiber orientation and functional therapy. Complete healing of that tendon typically takes about 6 months, with many patients reporting that they required 12 months before reaching all of their goals. So it's really important to note that tendon healing is a prolonged process, and adherence to a structured rehab protocol is crucial to achieve the best functional outcomes. Factors such as tissue quality, the strength of the surgical repair, and patient compliance with rehab significantly influence the healing trajectory. Today we've put Declan through his paces a bit. We've really focused in on trying to load that knee through flexion, and it's really going to get those quads going. And we've also paid special attention to his hamstrings. Now, another thing to consider, massive injuries like this really do take a toll on people, and you can often find you're feeling very low just because you're unable to do stuff. Easy things around the house where you're trying to wash up, cook are really, really tough, and it can definitely affect your mental health. This is why early wins are so important. Early wins in rehab, early wins on reducing pain, but also you've got to try and find ways in which you feel good. And with Declan, we know that he can smash his upper body, and he will get such a lovely feeling if he starts actually making some progress with that again. He's had quite a few weeks away from the gym, so today we're actually going to start stressing him in his upper body and get him working hard. Now, I've set the task of Declan hitting that rehab 3 times per week. We're going to catch up with him frequently. I'm going to get him in training with me as well. Again, it's going to be good for him, getting outside, training hard with someone else in the gym, and also hitting those legs. But quite quickly, he's going to make some really good progress. So it's really important we keep an eye on this rehab and actually make changes as quickly as possible. His body's going to adapt really well, and we want to start to progress that as much as possible. So we're going to see him regularly, weekly, and we're going to get him towards his end goal of returning to play.